So why would we want to do a meningitis workup in a kid just because they're a newborn? It's not just because they're a newborn, but that does definitely increase their risk of not being able to contain their infection where it belongs. The first thing to know is that the bacteria that often cause meningitis in newborns is different than the bacteria we worry about in older kids. And that is because they are brand new, their immune system is much lower, and the birthing process exposes them to some other bacteria that we aren't typically exposed to as we get older, and those things can take days or weeks to manifest into those more serious bacterial infections. Those would be E. coli and Group B strep. There are not vaccinations for either of those, though there have been some exciting new trials for Group B strep, and therefore we have to be really very cautious. Now, moms are recommended, if they are known to have Group B strep infection or colonization, to receive antibiotics during the birthing process to prevent early onset Group B strep infection. That is Group B strep infection that happens in the first couple of days of life, but that antibiotic administration does not prevent late onset Group B strep infection, which is why we still go looking for it when they're several weeks old. So we do break down those kids who are 4 weeks and under into 3 categories. We break them down into the first 7 days of life. Those infants are the most high risk for having invasive bacterial infection like meningitis or a blood infection like septicemia or bacteremia. And those infants would automatically be recommended to have the full septic and meningitis workup, including spinal tap, all of the time.